Hello, good day everyone. Here is today's news. WHO is disappointed Nigerians, other African countries are not dying as projected, official admits. In April, Melinda Gates, wife of the world's biggest do-gooder Bill Gates, was all fear on CNN when she expressed her fears. Look at what is going on in Ecuador. They are putting bodies out on the street. We are going to see this in countries in Africa, she said. She was lamenting how developed world were not playing the white knights well enough in the response to the pandemic in Africa, a continent which she believes can't afford washing of hands and social distancing because of poverty. Much earlier and up to recently, the World Health Organization too made its grim prediction, a quarter of a billion confirmed cases and 119 deaths in Africa. In fact, Tedros Ghebreyesus, WHO's Director General, couldn't hide his suspicion of figure manipulation 2 months ago when confirmed cases all over Africa was just 233. He believed that people were dying and it was just a matter of time when massive death reports would be exposed. When not much happened to validate his claim 2 months later, WHO had to adjust its model and crushed the number down to 1.2 million confirmed cases for West Africa and Central Africa. But Wednesday, the UN agency could not hide its disappointment or wonderment at the very low figures of infection and fatalities coming out of Africa. The director of WHO Regional Office for Africa, Dr. Mashidosi Moeti, had to wonder aloud during the African.com webinar series section 6 tagged "What's the real story behind Africa COVID-19 figures?" As stated on the Africa webinar series section, the world body admitted the dark continent is succeeding in controlling the spread of COVID-19. We are seeing fewer cases in Africa than expected, said Moeti, and things keep getting better. According to her, West Africa recorded 16% daily growth rate confirmed cases before April 1st. The rate has now gone down to 6.5%. In Central Africa, the growth rate reduced even more drastically from 14% before April 1st to 4% now. While the number of cases expected in the region on May 17 was 149,303, the case reported as of today is 8,021. WHO believes the African measures of curtailing the virus are working and are reporting slowing down of the rate of spread, Moeti said. Contravening Hadiji, who in March nearly accused Africa of cooking its figure, Moeti said, countries with higher testing levels per 10,000 people and sharing of data suggested a true picture of the outbreak. She even made a point of Nigerians' response to the Kano upsurge, and it was on this credit for COVID-19 in Kano State, Nigeria authorities responded quickly to curb the spread of COVID-19. Africa has remained one of the continents with the lowest infection and death rates since COVID-19 broke out in December, starting from China and spreading across the world by January. The US has recorded more than 1 million confirmed cases and well over 100,000 deaths. More than 40,000 Britons have died. Italy, Spain, Russia have also recorded very high infection rates and fatality figures. That is the news. This is so brilliant to hear that WHO, they are wondering how come the COVID-19 did not spread as they expected in Africa And they're wondering, really wondering, because they expected they were envisaging a very high figure, owing to the fact that Africans don't have good Medicare, we don't have good hospital. The only African country that could even boast of a standard hospital is South Africa. And God is so merciful here. He knows what He's doing. He knows the best. He knows how to take care of his own. So WHO, they're actually wondering, even countries that have the best Medicare, they cannot even handle the cases that, that came in their country. Italy, the surge in Italy was so high. Britain, America, Spain, France, they had a high rates of COVID-19 patients and deaths as well. So WHO, they are quite impressed the way African countries have kind of tried to make sure that the spread of COVID-19 is reduced to the barest minimum. They went as far as giving example, citing an example of the pandemic happened in Kano, how the government and the people of Kano took a fast move to try and curb it to reduce the spread. So good news on that aspect, that the spread of COVID-19 in Africa was very low, and the government, they are doing their best to make sure that it doesn't spread and patients are treated the best way they can. Thanks for listening. Drop your comments, drop whatever you think, and follow. Thanks for following our page. For those that are yet to follow, please kindly subscribe to get updates. Thank you. Bye.